How is thoracic outlet syndrome diagnosed? Well, sadly, TOS is pretty complex when it comes to diagnosing it because it overlaps with a lot of other issues, carpal tunnel being one of them. Now, a typical diagnosis for TOS will include several things like a physical exam, usually doing something like an Addison test or the Wright's test. You can probably guess some imagery, looking for extra ribs, something like that, with an x-ray. Or you can do something like a nerve conductment test to see if the nerves are damaged. So what kind of tests are used to diagnose TOS? Well, first off, you have something like the Addison test, which is basically when you are rotating your head and extending it while also allowing your PT, your doctor, to check your pulse to see if rotating your head in one way or not is going to compress the nerves and blood vessels, therefore weakening your pulse in your wrist or wherever they're checking at that moment. You also have stuff like the Wright's test, which is checking stuff more in the chest, but a very similar concept. But now we're basically bringing our arm out to the side. And again, the doctor is just checking the pulse and all that. And then you also have different imagery tests, x-rays to see if there's any abnormalities. You have different types of nerve conductment tests or vascular tests to see if there's any issues with those. These are all different kinds of physical examinations that you may have to go through if you are being diagnosed with TOS. How long does it typically take to diagnose thoracic outlet syndrome? Well, this can take anywhere from weeks to months, and it's basically because of the complexity of the TOS and how it overlaps with a lot of other issues that you have to rule out first. So for example, carpal tunnel syndrome and thoracic outlet syndrome can replicate some sort of tingling fingers, especially when you are doing something like working or driving. On top of that, because again, it is a little more complex and there's a lot of ruling out before you can call it TOS, technically, you have to go through a lot of specialized tests, which can take months to just schedule and book and get results back and things like that. So depending on who you're seeing, how much time is available, how complex your problem is, how much pain you have, all of these are going to play a factor when it comes to how long it's going to take to be diagnosed. Are there any conditions that can mimic thoracic outlet syndrome? Yes, of course there are, which is why it is so complex. With one of the first ones being carpal tunnel syndrome. Like I said earlier, carpal tunnel syndrome and TOS can both produce some sort of tingling in the fingers, which makes you think it could be one or the other. You can also have things like a cervical spine disorder because, again, the nerves coming out of the spine go into the shoulder and all to that. The main problem can actually be coming from the cervical spine, which then makes you think it's TOS because you're feeling it in the shoulder and arm. You also have things like brachial plex injuries, like injuries to the chest and the nerves around it. Or you will get something like shoulder impingement, which can create similar problems to TOS. What questions do you have about thoracic outlet syndrome? Let me know in the comment section below.